Yeah, so this is a poster that we are presenting, and this is data on a very small subset of patients who relapse post-CAR T cells. And what we were able to look at was whole genome sequencing, single-cell sequencing on patients who received a second infusion, and some of them we actually gave them nivolumab. And we had 4 patients where we have more of the sequencing data. And what you're going to see is obviously when you use drugs like nivolumab, which is a checkpoint inhibitor, it's a PD-1 inhibitor, it's not going to work in everybody, but it kind of brings up the issue of, in the context of these novel therapies, will there be a resurgence of some of these checkpoint inhibitors which have not been used in the context of myeloma? And in a subset of patients, if you have the genotype where you show an exhausted T cell phenotype and you show increased expression of PD-1, which was noted in this, it's a small set of patients, you are actually able to use a checkpoint inhibitor and restore some efficacy of those T cells. So really more of a hypothesis generating analysis here, and what we want to see is going forward, at least in the CAR T cell space, and even now I believe in the bispecific space, we have this opportunity of understanding the mechanisms of resistance and how is it that we're going to be able to overcome resistance and potentially maybe with checkpoint in a subset of patients.